First part is general description. First, paracetamol. Paracetamol is a pain reliever, analgesic, and fever reducer, antipyretic. It is commonly used to treat mild to moderate pain such as headache, toothache, and fever. Paracetamol does not reduce inflammation, but it is gentle on the stomach and generally safe for most people, including children and pregnant women, with proper dosing. Meanwhile, overdose can harm the liver. Second, ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory drug, NSAID. It is used to treat pain, fever, and inflammation such as muscle ache, period pain, and arthritis. Ibuprofen works by reducing substance in the body that cause pain and swelling. It may cause stomach irritation or affect the kidneys if used in high dose or for long periods. It is suitable for short-term use in both adults and children with correct dosage. Second part is drug classification. First, paracetamol. Therapeutic class for paracetamol is analgesic and antipyretic. Pharmacological class for paracetamol is non-opioid analgesic. Okay, let's move to the ibuprofen. Therapeutic class for ibuprofen is non-steroidal anti-inflammatory drug, NSAID. Pharmacological class for ibuprofen is propionic acid derivative. Third part is mechanism of action. For paracetamol, it inhibits prostaglandin synthesis in the central nervous system, CNS, especially in the brain. This reduces the sensation of pain and lowers body temperature. Unlike NSAID, it has very little anti-inflammatory effect because it does not work well in peripheral tissues. For ibuprofen, it non-selectively inhibits cyclooxygenase enzyme 1 and cyclooxygenase enzyme 2. This blocks the production of prostaglandin, which are responsible for pain, fever, and inflammation. Ibuprofen acts both centrally and peripherally.
After we get to know about the mechanism of action of paracetamol and ibuprofen, we need to know about the therapeutic indication for both drug, which is paracetamol and ibuprofen. Let's dive in together with therapeutic indication for paracetamol drug first. For paracetamol, it is used as a pain relief, which is analgesic, and it can use as a fever reduction. And lastly, paracetamol for clinical use, paracetamol can help in reduce headache, mild osteoarthritis, post-operative of dental pain. For ibuprofen, the therapeutic indication is it is used as a pain relief. Second, it is used as a fever reduction. Third, ibuprofen are suitable for inflammatory. And for clinical use, ibuprofen helps with muscle and joint pain, dysmenorrhea, and toothache pain. After we're looking at the therapeutic indication, we can go into introduction to medical condition that related to paracetamol and ibuprofen. It is stated that paracetamol and ibuprofen are widely used for pain and fever management, but the difference in how they work and in which patients they are most suitable. They are typically used in the following condition. For fever, cause example of fever is from viral illness, bacterial infection, post-vaccination, and post-surgery. Treatment role for fever, we can use paracetamol and ibuprofen both reduce fever. However, paracetamol is more preferred for children, elderly, and pregnant women due to the safety. For ibuprofen, it may be more effective when fever is associated with inflammation, as example tonsillitis. Second, we have pain, which is analgesia. Types of pain that treat is headache, toothache, muscle strain, menstrual pain, and etc. Treatment role for pain, we can use paracetamol because it is more effective for mild to moderate non-inflammatory pain, while ibuprofen is prescribed to patients who had inflammation, as example arthritis, menstrual cramps, or muscle injury. And lastly, we had inflammatory condition, which is as example rheumatoid arthritis, osteoarthritis, and for patients who had sport injuries like sprains and tendonitis. Treatment rule, we can use ibuprofen, because ibuprofen is non-steroidal anti-inflammatory drug, so it directly will reduce the inflammation. However, for paracetamol, it lacks significantly anti-inflammatory effect, so it is less useful in inflammatory pain. So, this is the clinical characteristic of the best treated patient population. We can divide the preferred drug by paracetamol and ibuprofen. So, I will explain to you the drugs that are suitable in each of the patient characteristic. So for pediatric patients, preferred drug is paracetamol. It is because the reason is paracetamol is much more safer, well tolerated, low risk of gastric or renal side effects. Second, we have elderly patient, which is the preferred drug is paracetamol. It is because elderly patient who take paracetamol have lower risk of GI bleeding and kidney issues compared to NSAIDs. For patients that need anti-inflammatory effect, as example arthritis, they can use ibuprofen because ibuprofen are more effective due to its anti-inflammatory properties. And for obese patients with musculoskeletal pain, drugs that are suitable for them is ibuprofen because it may be more effective where inflammation is present. For summary on pharmacokinetics aspect of the drug, we know that pharmacokinetics include absorption, distribution, metabolism, and excretion. So, paracetamol is preferred in patients with kidney issues because it has a safer renal profile, but must be used carefully in liver disease due to its metabolism pathway produce a toxic intermediate. For ibuprofen that has high protein binding and is more renal dependent for excretion, so caution is required in renal impairment. Both are rapidly absorbed, making them effective for quick relief, but ibuprofen may last longer due to its anti-inflammatory properties. After that, we can looking into patient counseling point for both drug, which is paracetamol and ibuprofen. First, let us look into dosage and administration. For paracetamol, the dosage that are suitable for adult is 500 to 1000 mg orally every 4 to 6 hours. Maximum dose of paracetamol is 4 gram per day. An IV form for paracetamol is often used in hospital for moderate to severe pain or post-op pain. For ibuprofen, dosage that are required for adult is 200 to 400 mg orally every 6 to 8 hours. Maximum dose for ibuprofen, they can take up to 2400 mg per day. And for pediatric dosing, ibuprofen are based on weight, which is 5 to 10 mg per kg per dose. Second, for duration of therapy, for paracetamol, it is typically used for 3 to 5 days for acute pain or fever. and paracetamol is longer used only under medical advice, especially in chronic condition. For ibuprofen, it is a short-term use, which is it is used not more than 10 days without medical advice. Prolonged use of ibuprofen can increase risk of GI, renal, and cardiovascular effect. Third, paracetamol and ibuprofen have potential side effects and management. And for paracetamol, side effect is rare at normal dose, but it can have hepatotoxicity at high dose. For overdose of paracetamol management, the physician can use an acetylcysteine immediately. For ibuprofen, the side effect is GI irritation, kidney impairment, and increased bleeding risk. Management for ibuprofen, patients need to take with food or milk to avoid in high-risk patients and monitor renal function if long-term use. And lastly, for contraindication and precautions of paracetamol, contraindication is for patients who had severe liver disease and hypersensitivity. Precaution for patients who take paracetamol is patients need to control the alcohol intake and do a dose adjustment in liver impairment. For ibuprofen, contraindication is for patients who had active peptic ulcer, severe renal impairment, and third trimester pregnancy. Precaution of ibuprofen is patients need to use in cautions with asthma, hypertension, and elderly because physicians also need to avoid in patients who have anticoagulants or bleeding risk.
Fourth part is interaction. For paracetamols, drug-to-drug interaction for paracetamol first is with alcohol. It can increase risk of liver damage. Second, with warfarin. High doses may increase bleeding risk. Third, with rifampicin, carbamazepine, and phenytoin. It can increase risk of hepatotoxicity due to liver enzyme inductions. Drug and food interaction for paracetamol. No significant interaction with food, and it can be taken with or without food. Let's move to the ibuprofen. Drug-to-drug interaction for ibuprofen. First, with antihypertensive such as ACE inhibitor or diuretic. It may reduce their effect and increase kidney risk. Second, with warfarin or other anticoagulant. It can increase bleeding risk. Third, with corticosteroid. Higher chance of gastrointestinal bleeding. Fourth, with other NSAID or aspirin. Avoid combination due to increased side effect. Drug with food interaction for ibuprofen is ibuprofen best taken with food or milk to reduce stomach irritation. The next part is drug storage and handling. For paracetamol, store at room temperature 15 degrees Celsius until 30 degrees Celsius. Keep in a dry place away from heat, moisture, and direct sunlight. Keep out of reach of children and do not use after the expired date. In terms of handling, use clean, dry hands or spoon for liquid or tablet form. For suspension, shake well before use. And do not exceed the recommended dose to avoid liver toxicity. For ibuprofen, store at room temperature 15 degrees Celsius until 30 degrees Celsius. Protect from light, heat and moisture. Keep out of reach of children and keep in original packaging to avoid degradation. In terms of handling, take with food or milk to reduce stomach upset. For suspension, shake well before use. and do not crush enteric-coated or extended release tablet unless instructed.
So, in conclusion, understanding the difference between paracetamol and ibuprofen is essential for ensuring safe, effective, and patient-specific treatment. Although both are commonly used to treat pain and fever, they are different in their mechanism of action, side effects, suitable patient populations, and risk profile. Knowing when to choose paracetamol over ibuprofen, example in pregnancy, children, or patients with gastric issues, and vice versa for inflammatory pain like arthritis, is help in making better clinical decisions and prevent serious complications such as liver damage from paracetamol overdose or gastric bleeding and kidney problems from ibuprofen misuse. This knowledge is also crucial for patient counseling, drug interactions avoidance, and managing special populations like the elderly or those with comorbidities. Overall, it ensures rational drug use, improve patient outcome, and support safe pharmacy or clinical practice.